Okay. Can I actually get you to turn and lay this, sit this way?
Certainly.
Yes, perfect. So now we're gonna go ahead, I'm gonna have you lay back down. Now we're gonna inspect the abdomen. I'm looking for any heaves or pulsations. I don't see anything. The abdomen is flat, which is an expected finding. So now I'm gonna go ahead and auscultate the 4 different quadrants, okay? Good. All areas are normal active, so that's an expected finding. It lets me know that you have good bowel sounds, things are working appropriately. And now we're gonna go ahead and percuss the abdomen. All right, all areas are resonant to percussion. Now we're gonna be doing a scratch test. It helps me to know where the liver borders are, okay? All right, liver is normal in size. This is an expected finding. Next, we're gonna go ahead and palpate the 4 quadrants. I'm first gonna go lightly and then I'm gonna go a little bit deeper. Please let me know if you feel any tenderness.
Okay.
Any tenderness? No? All right, gonna go a little bit deeper. No pain?
Okay.
All right, can I have you take a breath deep in, please? Okay, palpating the liver. Go ahead again, I'm gonna palpate on this side. The spleen is not palpable. And now I'm gonna go ahead and palpate your kidneys, okay? So I just want you to turn towards me. Just a little bit, just kind of. Okay, and the other side. Perfect. All right, and now I'm gonna be looking, I don't see any aortic pulsations, but I am gonna take a listen to the aorta. Excuse me. Okay, and I do hear a small bruit down by the, down here with the aorta, and that's normal, no concerns there. I'm gonna go ahead and palpate your femoral lymph nodes, okay? Okay. Perfect. I don't feel any enlarged. Any tenderness when I'm touching?
No, ma'am.
No. All right. You can go ahead and sit back up on the bed. Now I'm going to go ahead and inspect your upper extremities again. Like I said before, the skin is intact, no rashes. The skin turgor looks good, lets me know that you're nice and hydrated. When I pinch the skin, you have good capillary refill, you turn nice and pink. Those are all normals. The skin is warm and dry. I don't see any edema or lesions present. Go ahead and just move your arms in a circle for me. Lets me know that you have good range of motion. Please flex your elbows up and down. Good. Good range of motion there. And go ahead and move your wrist. Perfect. No issues with range of motion. I'm going to palpate your axillary lymph nodes. Let me know if you're having any tenderness. Can you let your arm out for me? Thank you. Any issues there?
No.
And over here? No issues?
No.
Perfect. Next, I'm going to go ahead and go do a scoliosis check. If I can get you to stand up, please. And just bend over. I'm going to take a look at the curvature of your spine. So I can feel the spine. The spine is nice and straight, so there's no worries for scoliosis. Go ahead and sit back down. All right, and now we're gonna go ahead and test your deep tendon reflexes. So the first we're gonna do is your bicep. All right, so we're looking for that deep tendon. Good. All right. And next we're going to do your tricep. So go ahead and just let your arm flex and hang for me. Good. Good response there. And next we're going to go do the brachioradialis. Good. And the same over here. We're going to find where that nice big tendon is. Perfect. Good. Okay. Next thing we're going to do is we're going to go ahead and do a sensory assessment. I just want to make sure that you're able to tell the difference between soft touch and firm touch, okay? So go ahead and just close your eyes. And when I touch you with the soft or the hard object, let me know which one is which.
Soft. Hard. Soft. Soft. Hard. Hard. Soft. Hard.
Perfect. Sensory response was normal. And now we're going to go ahead and do the same thing on the bottom extremities. I'm looking at the skin. The skin is intact. No bumps, bruises, lumps, rashes. The skin is warm and dry. And I don't see any areas of missing hair. So these are all expected and normal findings. Next, I want to go ahead and test your muscle strength. So can I get you just to lift your legs up for me? Perfect. Go ahead and resist me. Good. Now go ahead and twist your ankles around, kind of roll them, and push back against me. Good. And pull your toes towards you. Perfect. Next we're going to do is your deep tendon reflexes. So we're going to do your patellar, we're going to do your Achilles and a plantar tendon reflex. All right, so just go ahead and rest your knees. See if we can listen and respond. So that leg did bounce up, so your reflexes are intact for sure. Good. Next, we're going to go ahead and do an Achilles. So if I could actually get you to lay on your stomach. Thank you. And just kind of rest your legs. Perfect. Good. You can come back and flip the other way. And next I'm going to go ahead and check your plantar reflex. I'm just going to be taking this dull object and rubbing it across your feet. And let's see what kind of response we get. So that was the correct response, and the response we're looking for. We're looking for the feet to curve when they are touched with the dull object. Perfect. So we're going to go ahead and do the same test, sensory test that we did on the upper extremities. When I touch you with the soft item, let me know it's soft, and when I touch you with the sharp item, same thing. Go ahead and close your eyes.
Soft. Sharp. Soft. Sharp. 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 Soft. Soft. Sharp. Soft.
Perfect. All right, and next we're gonna go ahead and test your gait and coordination. So first thing I'd like to do is it's the heel to shin test. I'd like you to take your heel, yep, and go ahead and rub it up and down your shin. Perfect, and you're able to do that coordinated and nice and even. No issues there, so that's an expected and a normal finding. And can I get you to go ahead and stand up? And go ahead and just jump in place for me. Perfect, no worries. Go ahead and sit down so I know your coordination and your gait are all good. So next thing we're going to do is we're going to go ahead and just feel your pulses, okay? First thing I'm going to do is I'm going to feel your popliteal, which is located right behind your knee. Perfect, it's 2+. 2+ bilaterally. Now I'm going to test your dorsal and your posterior tibialis pulses. Perfect. 2+. Alright, so all of your pulses are 2+ bilaterally, which is a good and a normal and expected finding. I appreciate you today. Do you have any questions or concerns for me?
No, ma'am.
No, well, thank you so much. You look like a very healthy individual. Keep up the activity, keep up the clean eating and the diet. You look very healthy. I'll see you back again next year for your yearly checkup.
Perfect. Thank you
If
so
you have
much.
any questions, feel free to call the office.
Definitely. Thank you.
Thank you.